All right, we are going to go ahead and get started in just a few minutes. I am going to get us live on Facebook, so if you would just kindly be patient for a few minutes and we will get started. Alrighty, Commissioner Skujinski, go ahead whenever you're ready.
Recording in progress.
Thanks, Shannon. Appreciate everybody being online today to talk about peds vaccinations. Real quick, want to just give you an update. Our numbers are starting to come down on a daily basis. A month ago, we were around 150, 160. Right now, we're hovering around 60 per day. That is good news for our community. We continue to see the 100,000 rate drop as well too. We'll know more tomorrow on the exact number. So we're trending in the right direction, and hopefully we'll stay that way. But now for the big news. We heard last night that finally the peds from 5 to 11 vaccinations have been approved. And in county, at least for the health department, we received our first 1,800 doses last night. We should be receiving another 1,200 today. We ordered, our first order was 3,000. We order another 3,000, which we should get next month, or excuse me, next week. So total 6,000 right now. And we will look to see if we need to order more. In county, pediatricians' offices do have them. Several of them do. If you look at CVS or Walgreens or some of the other, big box pharmacy stores, they've also received them. So there is doses within inside of the community that should, again, get us a good start with our peds 5 to 11. The health department, we're going to talk today about what we're going to be doing over the next 2 weeks. We've been working with our school systems, and many of them have asked us if we can come in and give the peds vaccinations on site. And we have a number of schools, and we'll be able to share that list with you. We have a number of schools that have asked us to come in. And so what we've done is over the next 2 weeks, we've worked with them to schedule a time and a place to actually go in and do those vaccinations for them. So that is one option. What's going to happen is those school systems will be contacting the parents and letting them know when the vaccinations will be available, how to actually, again, sign up for them. And these are closed, what we call closed pods. And closed pods means that they are only going to be for the school or those schools that are within that pod themselves. So we're not going to be taking outside individuals there. We are going to be offering, if you would, open pods at our rec center. More to come on that. We're also going to gauge the interest of the community and at the schools, and again, adjust our schedule for open pods over the next week or two. And that should give everybody, again, ample opportunity to get their kids vaccinated from 5 to 11. The vaccine itself, again, like I said, we just received it yesterday. We do have the ability to, again, roll out the vaccines that we do have. We were waiting for some ancillary materials as well too, but we've received everything. I know that was a question from some of you. Do we have enough of supplies and enough of equipment and personnel to actually go ahead and do these? And we do. So that is a good thing. We were a little concerned about that. Why are we not starting today? Well, again, there's been so many things up in the air. When we were actually going to receive the vaccines, how much we were going to get, when it was going to be approved. We knew that it was going to probably approve this week, but we didn't know when. So we had to actually do some pre-planning to make sure this went off with as little as a hitch as possible. And that is why we decided to, again, work with schools and start next week, Monday, to start offering those clinics. And again, I wanted to make sure that we got the message out to the community that it's just not us who has vaccine, but again, like I said, hospital systems, pediatricians, those big box stores, Some of them do have vaccines. So if you feel like you need to have your child vaccinated right now and not wait for the schools, and or maybe your school isn't signed up with us, then there is that ability to go out and get your child vaccinated at some of those other sites. With that said, I'd like to open up for any questions.
Andrew with WTOL has a question. Andrew, go ahead and ask your question.
Hi, Eric. Thanks for doing this. Any idea how many Lucas County residents will fall into this new category? I mean, how many new people could potentially get the vaccine? And do you have any idea what percentage of parents will want to get their child vaccinated?
Let me take the last portion of that question first. We don't know how many parents are actually going to want their kids vaccinated. However, I will tell you the stories that we're actually receiving today at our rec center. A number of parents came in with their children thinking they can get their kids vaccinated at the rec center today. They were, let's say, very vocal about wanting their kids vaccinated. And again, some of the comments were, they want their kids vaccinated just because the disease is out there. But some of their schools that are out there have, removed the mask mandate. So those parents are concerned about their kids possibly being exposed at school. So there are a number of individuals, like I said, came to the rec center today. But the general sense of, again, what parents are going to want to get their kids vaccinated, we don't have a good handle on that. Now, the percentage of children as well, too, that peds that could get vaccinated right now, from if you would 0 to 18, we got to have about 70% of our kids vaccinated. Again, some of these age groups who can't be vaccinated right now, 5 to 11, 5 and above, can be vaccinated. So, just kind of a number off the top of our heads, probably around 12,000 to 15,000. Again, looking at the doses too that are coming in, I think that's probably a low number. But again, just know that we're going to have enough of doses within inside the community for any of those peds 5 to 11 that want to get vaccinated. We'll have doses in the community. I think Melissa has a question.
Yes. My question is, what are the most common concerns that you're hearing from parents, and what can you say to address those?
Melissa, that's a great question. And I think some of the things that we're hearing, of course, is, when can I get my child vaccinated? Again, we kind of are working through that process, and that's much better known today than it was yesterday. I think too, what about, the research and, is the vaccine safe? Yes, the vaccine is safe. We know that from the research that's been done already prior to the approval of the vaccine, that there are similar reactions that we've had with the adult vaccines or the older kids vaccinations. But we haven't really seen any of those severe reactions that we've talked about in the past. So again, we're trying to make sure that the word gets out that this is a very safe vaccine, and the symptoms are, relatively mild. The biggest concern that I think any of us have with these vaccinations is the arm soreness. So that's another thing too, what to expect. Again, I would expect the arm soreness. So for these kids 5 to 11. And I think too that in general, there's a little bit less questioning right now than we've seen in past age groups, because I think people are seeing that, well, we've had so many people vaccinated and there really has been very little problem with the vaccines. And so I think there's a little bit easier time with this, not saying that it's, it's not like getting, a typical vaccine for childhood illnesses. But again, I think there's a little bit more comfort right now.
Okay, thank you.
Sure. Shannon, are we going to share the listing of clinics that we're going to be responsible for over the next 2 weeks?
Sure, I can do that. Just give me
Great.
one moment.
Sure. Yeah. Just been reminded that because of logistics and the amount of staff that we need to do these clinics, we're going to put a hold on doing boosters at our rec center. And I do believe that we will pick that back up after we get through these peds vaccinations. So what you have on the screen right now, thank you so much, Shannon, is our listing of schools that we're going to be going to. Just for example, let's just take the first one, November 8th and 9th, which is Monday and Tuesday of next week. We're going to be at the Sylvania school districts from 4 p.m. to 7:30 p.m. And that location for the Sylvania schools, Otto Hill schools, and St. Joseph Sylvania will be at the Stranahan Elementary School. And you can work yourself down the rest of the list. And this is kind of how we've been able to work at the schools and plan this out. Again, understanding that limited resources in the sense of logistics, moving things around, the bodies that are needed to actually vaccinate this age group as well too, a little bit different than adults. So thank you to the school systems that have worked tirelessly to make sure that we can make this happen in a very short time.
We will also have that posted on the health department's website and social media pages as well.
I really do believe that is all that we wanted to get out to the community today. Again, the idea here is another segment of our community who, can go ahead and protect the rest of us as well. That 5 to 11 vaccination program and process. It's great, but the better thing is that as we try to get back to normal life, this is going to be able to get us back quicker to more of a, if you would, a normal school year, a normal school day for that matter. And again, just protecting the little ones is so important. So Shannon, that's all I have.
All right. Thank you so much, everyone. Have a great day.